Paul here with Rika Physical Therapy and Wellness, talking to you today about headaches. So we treat a lot of patients who have headaches in our office. Traditionally, these headaches will sort of derive from the base of the skull, so what's called the suboccipital region. We have some muscles right underneath the occiput here, right, the base of the skull, and these muscles tend to get a little bit restricted. They get tight. We develop trigger points within those areas, tender points, and symptoms will start to radiate towards other parts of the neck, sometimes up through the top of the head, and then retroorbitally right behind the eye. So a lot of our patients will say that they get some pain right underneath the base of their skull, over the head, and then retroorbitally behind the eye. Very often we'll also see patients who suffer from what's called tension headaches, and there's almost like a band coming across the forehead horizontally, like so. We will traditionally do a lot of trigger point therapy, massage therapy to the neck musculature. We'll work on some joint mobilizations on the upper cervical spine. So typically the top vertebrae, C1, C2, those sorts of areas. You'll also see sometimes TMJ, temporomandibular joints, with jaw pain when somebody suffers from neck pain. So they'll think they have TMJ, but it's really stemming from the neck. We also do treat TMJ if it is a true TMJ issue. We often use acupuncture as a supplemental treatment technique to our physical therapy interventions. With acupuncture, our acupuncturists will use very thin microfilament needles and insert them into the trigger points within those suboccipital muscles and the rest of the neck musculature that may be triggered or may have some soreness.